Is almost upon us. One professor from Northern Illinois University says COVID-19 in some ways is more like the common cold than the flu.
So joining us now is biologist Dr. Barry Bode. Thanks for joining us.
My pleasure.
Well,
Thanks
Doctor,
for having me.
Great having you here because, first of all, we haven't heard much about the fact that the COVID-19 virus is more like the cold than the flu. Why is that? And, you know, why are so many people comparing it to the flu instead of the cold?
Well, I think there's a couple of reasons. First of all, SARS-CoV-2 is something called a coronavirus, and it's the same family of viruses that do cause the common cold, and that's why you hear that a lot, is that it's basically the same family of viruses, but it evokes different symptoms, obviously. And in some ways, I think people compare it to influenza because the last major pandemic we had was, of course, the 1918 Spanish flu or influenza outbreak. And, you know, it's 102 years ago. So I think there's a lot of equation between the two, but biologically, they're from two different types of viruses.
And why are you concerned that there are so many similarities to the common cold?
Well, I'm not concerned that there's similarities to the common cold. They're just happen to be in the same viral family. What is concerning, though, about SARS-CoV-2, even amongst some of the other coronavirus outbreaks we've seen, say, within the last 20 years, is that SARS-CoV-2 seems to be very easily transmitted between people. And only a subset of people seem to react very badly to it with that respiratory syndrome, which is what causes so much of the mortality.
So is a vaccine going to help with this COVID-19 virus?
I believe it will. There are currently several clinical studies going on with different vaccines. Early reports are that they are raising immune responses. The outstanding question is how long will that immunity last and how protective will it be for the people who receive it?
So it's not going to be the cure-all that it's made out to be?
It's not a panacea.
Okay.
But what it is it's a component of an otherwise larger program that we'll have at our disposal, hopefully, to help mitigate some of the devastating effects it's had on everything from our society to the health of people to everything else. So I think people are really awaiting the emergence of these vaccines to see if they're going to help.
How concerned are you about flu season this year and it coming right along with the current ongoing outbreak of COVID-19?
Well, flu season is flu season, and we get that every year. Everybody gets their flu shots, and the public health officials kind of hedge their bets as to which strain of influenza is going to be prevalent, and that's how they manufacture the large lots of the vaccines that people get. But I think what's most concerning to people from a public health perspective is that flu season, people are all heading back indoors, and we know that SARS-CoV-2 is very efficiently transmitted when people are in close quarters indoors.
Should we get a flu shot? And how are we going to know the
Yes.
difference between the flu and COVID?
Yes, you should get a flu shot. I think we should all get flu shots. And I'm sorry, what was the second question?
Oh, I just wanted to know, and I know this may not be a fast answer, but how am I going to know the difference between COVID and the flu if I get either one?
That's a really good question, and you'll likely get tested.
Okay.
There are a lot of very good websites out there, and I'm sure you're familiar with many of them, where you can go, and the CDC is one, the Illinois Department of Public Health has another one, where you can go and see how many of these symptoms for SARS-CoV-2 you and yep.
All right.
Dr. Barry
Thank you,
Bode
sir.
from Northern Illinois University. We appreciate your time and expertise.
Be safe, be well.
All right, you too.
Thank you.